Good evening, Miss Singleton. Thanks for coming in today. How are you doing?
I'm doing okay. Just having a couple of questions.
Okay, I know that our last session you stated that you were getting your medications changed and your doctor was prescribing you something different. How is that going?
It's going okay. I guess that's where my question lies. I've been prescribed Abilify, and that's supposed to be for my bipolar disorder. So what I'm trying to figure out is how this medication is actually supposed to work.
Okay, I actually have a few clients who are taking this medication, so I perfectly roughly kind of know a good bit about it, so I can
Okay.
kind of help you out. But I'm going to firstly start by showing you a commercial on this medication. Would that be okay?
Yes.
Okay.
Bipolar disorder is challenging and can affect your job, family, and friends. For years, I had severe mood swings, racing thoughts, unusually high energy, and was extremely irritable. My doctor and I discussed my options. He prescribed Abilify.
Abilify helps control symptoms of bipolar mania and reduce the risk of manic relapse. Request your free information kit. Call your doctor if you have high fever, stiff muscles, and confusion on Abilify, as these may be signs of a life-threatening reaction, or uncontrollable muscle movements, as these could become permanent. If you have diabetes or are at risk for it, your blood sugar should be monitored. High blood sugar has been reported with Abilify and medicines like it. In some cases, extreme high blood sugar can lead to coma or death. Elderly people with dementia taking Abilify have an increased risk of death or stroke. Call your doctor if you have unusual or worsening mood changes or thoughts of suicide. Other risks include dizziness upon standing, impaired judgment or motor skills, or trouble swallowing. Hundreds of thousands of patients have been prescribed Abilify. Ask your doctor if Abilify is right for you.
Okay, that is a clip that I always, keep for clients who are inquiring about different medications that they are seeking. So I hope that that helps some for you.
Yes.
And any more questions that you may have, I am here, to help you
Okay.
with them.
Okay.
So, what would you like me to help you with, Miss Singleton?
I was trying to figure out how this medication actually works and what will it do to me.
Okay. First, let me speak to you about your illness. Are you aware of your illness and are you very educated on your illness?
Yes.
Okay, because you've been diagnosed with bipolar, which this is an illness that involves mood swings. Sometimes you're up, sometimes you're down. Some days you're happy and some days you're sad. Some you don't know when it's going to come. It just hits you,
Mm-hmm.
and that's why doctors prescribe these medications to basically balance out the person.
Okay.
As a child, have you ever experienced this like as a child, like different mood swings?
Yes.
Okay.
As a child, I did experience having the mood swing issue.
Okay.
It was difficult for me because I never really had any friends. Um, Usually they're afraid of me. Everyone's trying to figure out like how I'm going to react to any given situation, whether it's going to be a good reaction or a bad reaction. So it's like instead of actually putting forth the effort, it was like everyone kind of was standoffish with me.
Okay, and that's why I asked you about your childhood because usually bipolar starts at a very early age in children and it goes through adulthood because this is lifelong. Not only do you need to be educated on this, but so are your loved ones because they're going to be with you throughout this journey.
Okay.
So if you feel as one day you need to bring some of your family members in so I can better, help you and explain to them about your illness so that they're able to help you, I am willing to do that
Okay, that
because
sounds
everybody needs to be on board with this with you.
good. Okay. Well, I'll see who will be willing to participate.
Okay. Um, like I told you, it's a lifelong condition. You're bipolar, which with you being prescribed the brand Abilify, that is Abilify works by chemically breaking down your neurotransmitters in your brain.
Okay. The neurotransmitters, is that the thing that actually helps me? Like, is it what causes me to have the good days and the bad days?
Yes, it all operates together, but it's the medicine is going to be breaking it down. But what I am going to tell you, it is not going to do it 100%.
Okay.
What it will do is kind of cause a balance.
Okay.
So you won't experience the mood swings as much as you were experiencing them. Do you kind of get where I'm going at with
I
that?
do.
Okay, so it's going to break it down. The medication is an antipsychotic medication, okay? That's the class that it's in. It's like an antidepressant. So it works for people who are, having severe mood swings, and which when you're diagnosed with bipolar, that's one of the main things that you encounter are severe mood swings.
Yes.
Okay?
Okay. So the next question is, when it comes to the length, how long how long would I know the medicine is actually working? Like, is it going to be a time period where it's 6 days, 3 months, 10 minutes, 5 hours?
Okay. With this medication, you can go to your prescribing doctor to basically see, they can kind of like give you, if they do tests just to see if this medicine is actually working. But it's not going to work instantly when you take it. And the reason I say that is because it's all up to your body. It's what your body consumes daily. And it's, how your body operates. No medication that you consume is going to just work instantly. Okay. It may take hours, but with this type of medication, I'm going to say give it a few weeks.
Okay.
Family members may see that your mood swings are decreasing, and you may even see it. But just to say you're going to take it and it's going to work within an hour, don't expect that to happen, okay? Okay.
So, when it comes to side effects, every medication has side effects, especially when it comes to a medicine that is going to help, alter my personality. What side effects should I be expecting?
Side effects with Abilify are common, and sometimes it can get severe. Some side effects are vomiting, nausea, headaches. You can become fatigued. You can get dry mouth. You can also become dizzy, and the list can go on. But it just depends. And another thing I'm going to tell you is these side effects can become severe if you mix this medication with alcohol or any illegal drugs. And illegal drugs, I mean by marijuana, heroin, cocaine, just to name a few.
Okay.
So you will have side effects, but the severity of the side effects depends on some of the things that you accumulate in your body, and that includes alcohol and illegal drug substances.
Okay.
Okay.
My next question was, would I be able to stop using this medication at any point in time?
I don't suggest you just to stop taking this medication. If you are on a schedule taking this medication regularly, don't ever just stop taking it. Okay. What you can do is wean yourself gradually off the medication.
Okay.
Speak to your doctor first about it.
Okay.
See how your doctor feels, and then you can take the steps from there. But just to abruptly stop taking it, you don't want to do that. Your body can go into a shock and possibly a coma, and you may have to go to, and be medicalized or hospitalized, of course. Those things happen.
Okay. What else? When it comes to how I should take this medicine, when it comes to the dosages that I'm given, how am I to consume this medication?
The medication can come in 3 forms.
Okay.
The 3 forms of this medication is liquid, injection, or you can even take it pill-wise. It's your preference on this medication, whatever you feel comfortable in taking and whatever you will remember to take.
Okay.
Okay?
Saying that, when it comes to taking the medicine, if I decide to take the pills, sometimes my days get busy and I may forget. So when it comes to like doubling up or anything like that, what do you recommend?
Okay, I recommend that if you do forget to take your medicine, once you remember, try to take it right then and there. Okay. But if you remember at the time that you're about to take it, like an hour before, don't take it. Okay. Just take it in the time frame of the next, following hour, but never double up on your medicine. Okay. Okay? Don't ever do that.
Okay.
And I also want to, inform you that blood testing is required to monitor the level of drugs in your bloodstream. And I say that because taking this medicine may stop your period. And taking different doses of this medicine can, have, you know, you may have to monitor your blood. So just be mindful of that, and just be aware that this medication can stop your period, your menstrual cycles. Okay.
Okay.
All right. Do you have any other concerns about taking this medication?
No, I think you have pretty much covered all the aspects that I had questions about when it came to the dosage, the missed dosage, the side effects, and the actual purpose of the medication.
Okay, and I also want to just, you know, inform you that signs of that you have overdosed on this medicine are scattered memory,
Okay.
scattered memory loss, hypertension, just to name a few.
Okay.
So if you ever feel that you're going through any of these, you need to contact, you know, of course, 911. And also, you know, you can know that you overdose if you start to feel like we are weary, and if you're around family members and you go into a coma, you kind of fall out. That's like signs of overdosing on this medicine.
Okay.
So like I said, contact 911, your prescribing doctor. There's like a poison hotline that you can also call
Okay.
in this case. I feel like with your doctor prescribing you Abilify, he did the right thing.
Okay.
I feel like you should start with a small dosage amount before you go into any kind of huge quantity of taking this medication.
Okay.
Just, you know, to get your body to regulate on it.
Okay.
Okay? And I appreciate you coming in today, you know, speaking with
Thank
me.
you.
And if you need your family members to get educated on this medication along with your illness,
Mhm.
feel free to go to the front desk and set an appointment.
I will do that.
Thanks, class, for my presentation. And you can stop the recording.